Traditionally, with issues with the upper eyelid, we've always relied on upper eyelid surgery or blepharoplasty by removing skin. And usually, individuals in the ages of over 30 start to notice some laxity in that area. Now, we've also used lasers and chemical peels to treat the crepiness of the skin, but we've never had any tools to thicken the skin itself. And quite frankly, in the earlier ages below 40, one of the reasons we see the upper eyelid laxity and what we call blepharochalasis has to do with the fact that the skin is getting thinner. And also the subcutaneous fat and also periorbital fat are getting thinner as well. So with the study that we presented had to do with looking at different individuals who were injected with an hyaluronic acid, namely Restylane, because it is not that hydrophilic, with micro doses, and it was diluted to a higher extent with a 1-to-1 dilution with lidocaine, so that it would be placed in the subcutaneous tissue and improve the thickness of the skin. And when we did that in ages that were in the mid-30s, that was extremely effective, and we were able to hold patients off to a later age in case they need blepharoplasty. Now, one patient in particular, for example, needed a blepharoplasty a year later. So we actually took the skin from the blepharoplasty, sent it for histology, and we noticed that particles from the hyaluronic acid were still there, right over the muscle and at some points into the muscle, orbicularis oculi muscle, and in subcutaneous tissue, which was very interesting finding. So anything that involves the periocular area around the eyes, this is a very delicate, anatomically very complex area. Obviously, because of the fact that you have the orbit, the eye, you have the vessels that not only connect to the eye, to the skin, but also if you are not careful, you can cause intracranial issues as well, by injecting higher volumes at a high pressure. Therefore, it requires the individual that are injecting to know the anatomy very well.